A case of Jn.1, a subvariant of COVID-19, to be precise, of Omicron has been reported in India. There is in fact a second case that has been reported, one from Kerala, one from Tamil Nadu. The Union Health Ministry says the surveillance is on. A review meeting is also being held by the government. Jn.1 was first detected in Luxembourg in 2023. It has spread to the US, Europe, Indonesia, Singapore, Malaysia and many other countries. It makes up for up to 30% of COVID cases in the US now. It could be the reason behind the rise in COVID cases in India as well. India's active cases are increasing currently. Subvariant of Omicron, the fifth variant of concern with lakhs of mutations so far. That is what Jn.1 is. It is a descendant of BA.2.86. Single change in spike protein of BA.2.86 and Jn.1 capable of spreading faster and evading immunity, and that's the reason why the World Health Organization has labeled it as a variant of interest. The first case, like I said, was in Kerala on the 8th of December. India would have more cases of Jn.1 than what has been counted up until now, given that genomic sequencing is an ongoing exercise. No increase in hospitalization or death so far. The WHO says that vaccines continue to be effective to protect against severe infection. Jn.1 is from the family of Omicron. The season of viral infections are upon us. The festive season is expected to lead to further spread. The government says vigil to be maintained. Countries should be testing, genome sequencing must be done, is what the WHO says. So what should you do? Report flu-like illness. Do not step out if you are unwell. It could very well be COVID-19. Essentially, the RT-PCR testing rates have gone down in India. A survey says only 1 out of 10 people are going in for an RT-PCR test. Essentially, when you're sick, do not step out. Wear a mask if you're feeling sick. Vulnerable should exercise caution, definitely. What is the government then asking states to do? To test more, send positive samples for genome sequencing, report influenza-like illness, report if there are cluster infections that are occurring. Enforce respiratory hygiene measures is what the government has asked the states to do. Around the world, there's been a surge in Singapore, over 56,000 cases. Masks have returned here. Travel advisory has been issued. America seeing a surge. 10,000 plus hospitalizations in the US. 30% of cases in the US are because of Jn.1. Essentially, the government says we are watching the situation, though this is not any more deadlier than any of the subtypes of Omicron. Vaccines, like I said, are effective and the spread is expected given the festive season. So experts essentially say if you're traveling or if you're gathering inside for holiday festivities, improve air circulation in the house, wear a mask in airports and on planes and other public transportation. That's what you should be doing right now.